Hello, I'm Dr. Vakil, Leelodharry, gynecologist from Mauritius. It has been a wonderful journey, rich in knowledge at the Indira Fertility Academy in Udaipur, India. This training program has been facilitated by the Merck Foundation in view of its initiative More Than a Mother campaign, which aims to empower infertile women through access to information, education, and a change in mindset, hence breaking the stigma of infertility in African women. These women are mostly working population and in some cases the sole breadwinners of a family, which delays the childbearing age, contributing to an increase in infertility rate. Mauritius is a small island in the Indian Ocean, and according to recent statistics, the fertility rate is on a declining trend with 1 child per 100 couples. Advanced fertility treatment in Mauritius is mainly privileged for patients attending the private health institutions. Hence, the government of Mauritius initiated the project of establishing a fertility clinic in the public sector. Currently, this service consists mainly of medical management, and the aim is to introduce advanced reproductive techniques in phases, with the first phase being intrauterine insemination by the end of this year, which will be a stepping stone in fertility care in the public sector in Mauritius, where healthcare is free. To facilitate the training of gynecologists and laboratory technologists in advanced reproductive techniques, the government of Mauritius has approached the Merck Foundation. However, the setting up of a fertility clinic in the public sector is challenging in view of cost implication and legislation regarding gamete donation and surrogacy in Mauritius. All these will be addressed by the Ministry of Health and Wellness accordingly. Advanced fertility care, like gamete donation, is not available in Mauritius, and many patients who need this line of management must travel abroad, like most of them travel to India, and the cost is quite high. Mauritius is not spared regarding the contribution of male factor infertility. So, male factor infertility basically contributes to 20 to 30% of the causes of infertility, and the risk factors mainly are advanced paternal age, smoking, and stress factors. So the government of Mauritius has established smoking cessation clinic and psychological counseling to tackle these factors. I started my training on infertility at Indira Fertility Academy, which is one of the best institutions in India. There are around 110 Indira IVF centers all over India with good success rate. Soon they will be established at an international level as well, like in Nepal and Bangladesh, to help couples with infertility, which is very distressing. The training program at Indira Fertility Academy is well established, with a platform of academics to interact with and to acquire the surgical experience and insights regarding infertility management. The theoretical aspect starts from the basics and covers all evidence-based concepts of infertility care. Moreover, the training program is supplemented with daily patient case discussion from renowned faculties all around India, which further enhance our knowledge regarding the management of infertility. Indira Fertility Academy puts a lot of emphasis on practical training, which enables the trainee to acquire much skills before practicing ART surgical procedures. The surgical training starts in the simulator laboratory of the academy, where we are exposed to hysteroscopy and oocyte retrieval simulators. There is also a simulator for embryo transfer and intrauterine insemination. The simulators help in developing the mind, eye, and hand coordination before we can start performing on live cases. Indira Fertility Academy is one of the institutions that provide a wide exposure to hands-on training under the guidance of consultants. Moreover, the Academy has a transvaginal ultrasound simulator and through a scan trainer pathway. Moreover, the Academy has a transvaginal ultrasound simulator and transvaginal ultrasound is a must in infertility management. So there is a scan trainer pathway. The scan trainer pathway helps the student to develop his scanning skills. We are also exposed to patient counseling in outpatient clinics and also doing daily scans over there. There is continuous coaching by the consultants regarding the management of patients with infertility, which helps to put into practice the theoretical aspect. Though the training is extensive, I would definitely recommend any gynecologist, any andrologist, or any embryologist who aspire to become an ART specialist to join Indira Fertility Academy. Once the training is completed, I will return to practice in Mauritius and help in the setting up of the first phase of ART treatment, that is intrauterine insemination in the public sector by the end of 2023. I also aim to establish a continuous training platform with Indira Fertility Academy and the Merck Foundation. I would like to thank the Indira Fertility Academy and the Merck Foundation for providing this excellent training platform to doctors around the world, mainly in the African and Asian continents. I strongly believe that the training provided will definitely help doctors of these parts of the world to become better ambassadors for many infertile couples who live with hope and despair trying to become parents. Thank you. Mauritius.